on ancient medicine. Anyone who attempts to discuss medicine without a foundation in reality has fundamentally erred, and this mistake is more egregious given that medicine is crucial on life's most important occasions. Without a solid basis of knowledge, medical practitioners would all be equally unskilled and reliant on chance. However, we now see significant differences in skill and understanding among medical practitioners, just as we do with other arts. Therefore, I don't believe medicine requires an unnecessary hypothesis like those used for discussing the unknown, such as celestial or subterranean phenomena. Medicine would not have developed if the same foods and regimens worked for both the healthy and sick, as people wouldn't need to investigate it. However, humanity discovered medicine because the same substances didn't work for everyone when they were ill. As people suffered from their unprocessed diet, they had to adapt by discovering new foods that better suited human nature. By moderating the strength of these substances with weaker ones, people created a more suitable diet for their own bodies, allowing them to thrive rather than suffer from diseases and early deaths. This discovery and refinement of foods for human health and well-being is what we call medicine, a field developed to replace our primitive diet and ensure nourishment, growth, and safety. I believe that if diets suited people equally in health and sickness, there would be no need for medicine at all. This principle applies universally. Stronger substances tend to cause more harm for humans, regardless of their health status. The person who developed a universal diet for humanity after it had been living in a primitive state is similar to the one who established medical practices. However, even a healthy person's diet can have negative consequences if they consume food meant for animals like oxen or horses, such as vetches and barley, in excess. Similarly, a sick person eating what is typically considered healthy human fare, like bread or cake, but in an unbalanced manner, will still experience adverse effects. This illustrates that the principles guiding medical discovery are akin to those of other sciences. Understanding the optimal balance and moderation in diet for both the well and the ill is crucial. If they deviate from their usual eating habits, even for just a day, they may experience drowsiness, lethargy, and thirst. And if they further alter their diet by adding an extra meal, they can develop symptoms like bloating, abdominal discomfort, and diarrhea. Additionally, anyone in good health who goes without food for 2-3 days will likely experience similar adverse effects. If one of the 4 elements, hot, cold, moist, dry, is causing harm to a person, then the correct treatment would involve applying its opposite element. The author emphasizes that the human body reacts differently to various types of bread and cake, depending on factors like grain type, moisture content, processing, baking, and more. Similarly, each person's body is influenced by these differences in food, affecting their health, recovery, or illness. The ancient founders of medicine didn't believe that fundamental elements like dry, moist, hot, or cold were inherently harmful to humans. Rather, they considered extreme qualities, like intense sweetness, bitterness, acidity, and saltiness as the culprits behind harm when they dominate a substance. The author notes that most everyday foods like bread, cake, and other staples don't possess these intense qualities. The author concludes that it is essential to comprehend these subtleties of food and their effects on the human body in order to understand health, illness, and the art of medicine itself. If one were to advise taking a hot remedy, the patient would ask what it is and probably opt for a familiar substance like food or drink. Heat and cold, despite being significant factors in our bodies, have a relatively limited impact when not extreme. One might argue that individuals in severe illnesses like high fevers or pneumonia don't quickly recover from their elevated body temperatures, nor do they experience such rapid fluctuations of heat and cold. Instead, it's the specific characteristics of heat, which can be bitter or acidic in nature, combined with other qualities like cold, that are actually detrimental. In general, many human ailments arise from imbalances in four fundamental qualities: bitter, acidic, hot, cold. The process of cooking, changing, and combining these qualities, humours, is crucial in understanding human health and disease. Certain experts argue that a physician must first understand human nature, origin, and construction in order to truly practice medicine effectively. One proposed that the true understanding of nature can be gained through the study of medicine itself, as it provides insight into the effects of various foods, drinks, and occupations on humans. It's not enough to simply know that a particular food is bad. One must also understand its specific impact, causes, and interactions with individual bodies. During recovery or prolonged illness, various complications can arise, some naturally occurring, others triggered by accidental factors like treatments or new foods. It's crucial to understand the effects of these activities on a person so they can be properly applied and avoid causing harm. The author argues that understanding the role of both physical structure and internal juices, or powers, in the human body is crucial for grasping how diseases arise. There are numerous types of bodily structures within and outside the human body, varying greatly in terms of both health and disease-related afflictions. It's essential to understand the properties and interactions of different juices when it comes to human health, on airs, waters, and places. To truly understand medicine, one must consider various factors. First, the seasons, each producing distinct effects, should be studied. Then the prevailing winds, both hot and cold, as well as those unique to a specific region, require attention. The qualities of water, differing in taste, weight, and properties, are also crucial. When visiting an unfamiliar city, one must consider its location regarding wind directions and the sun's rising and setting points, as these factors have different influences depending on orientation.
Also examine the natural environment.
Does it lack water, feature forests, lie in a valley, or be elevated and cold? In cities exposed to hot winds during certain times of the year and sheltered from northern winds, the water sources tend to be plentiful, salty, and fluctuate in temperature between hot in summer and cold in winter. The region also sees specific diseases. Women suffer from heavy menstruation, infertility due to illness rather than natural causes, and frequent miscarriages. Infants are prone to convulsions and asthma, which locals consider a sacred condition, epilepsy. In locations where cities face cold winds during summer solstices and equinoxes and are shielded from southward heat and breezes, certain characteristics prevail. People's bodily fluids tend to be hard and cold, making them more prone to issues like constipation, biliousness, and ruptures of vessels. Common seasonal illnesses can afflict both men and women, but women specifically struggle with irregular menstrual cycles, painful periods, difficult childbirth, and an inability to nurse their children due to the hardness of the water. In summary, this phenomenon is characteristic of locations exposed to cold and hot winds, with cities facing such conditions exhibiting the described traits. Cities situated between the summer and winter solstices, facing either towards or away from the rising sun, exhibit certain characteristics. In terms of climate, these cities are like spring, neither too hot nor cold,
with fewer and milder diseases similar to those found in regions exposed to warm winds.
cities situated westward, shielded from eastern winds, and only occasionally touched by cold northern winds, typically experience poor air quality and unhealthy conditions. The water in these cities tends to be murky due to frequent morning mists that mix with the water, obscuring its clarity until the sun is high enough in the sky. He begins by describing stagnant or marshy water from lakes, which is often hot in summer due to the sun's heat, but can be congealed and muddy in winter. Drinking such water can lead to poor health, including enlarged spleens, emaciation, hoarseness, and a tendency towards dropsies and other diseases. The author provides guidelines for choosing the right type of water based on an individual's health and constitution. This occurs because the diverse waters contain varying levels of sweet, salty, aluminous, and thermal properties, which can clash and cause the strongest characteristics to dominate, leading to the formation of deposits in the body that contribute to these health issues. If the autumn has rain, winter is mild, spring shows seasonal rainfall, and summer is hot without excessive humidity, it's likely to be a healthy year. However, if winter is dry and cold, spring is showery and warm, and summer is extremely hot, it will probably lead to ophthalmies, dysenteries, and other fevers due to the sudden heat and humidity. A southerly winter, showery spring, and southerly summer can cause the earth to be moistened by rain and heated by the sun, leading to an overload of humours in the body. A dry winter and northerly spring, followed by southerly summer weather, increases the risk of miscarriage or delivering sickly children for pregnant women, as well as dysenteries, dry ophthalmies, and catarrhs for others. Older individuals with flabby veins are more susceptible to sudden death or paralysis due to a southerly winter and a northerly dry spring followed by hot summer weather. Cities situated well in terms of sunlight and winds, using good water, feel these seasonal changes less. A rainy and southerly summer followed by autumn leads to a sickly winter, ardent fevers for phlegmatic people over 40 years old, and pleurisy and peritpneumonies for bilious individuals. A completely dry season without rain is most beneficial to phlegmatic people, those with a humid temperament, and women, as it helps them dry out. The author aims to highlight the significant differences between Asia and Europe in terms of their natural environments, inhabitants, and physical characteristics. According to the author, Asia differs substantially from Europe due to its milder climate, more beautiful and larger productions of the earth, and gentle, affectionate dispositions of its people. A similar pattern applies to the people living there. Their characteristics can be likened to different environments, some being like lush, well-watered forests, others resembling arid plains or marshy areas. The diversity of seasonal influences on an individual's physical form directly correlates with the differences in their appearance. The greater the variations in seasons, the more varied the shapes and forms of the people living there will be. The people of Phasis inhabit a wetland region with warm and humid climate, experiencing heavy rains throughout the year. Their climate experiences minimal seasonal changes in temperature, and southerly winds prevail, except for a local wind called senkron that can be strong and hot. The author attributes the generally peaceful nature of Asians compared to Europeans to the stable climate in Asia, which lacks extreme temperature fluctuations or dramatic seasonal changes that might stir up emotions and passions. Nomadic Scythians live in portable wagons covered in felt, built like small houses with 1 to 3 rooms, which provide shelter from rain, snow, and wind. The Scythian people, similar to the Egyptians, exhibit a unique physical uniformity despite being a distinct nation. The region's geography, with its proximity to the Riphaean Mountains and northern winds, leads to a cold climate where winter persists throughout the year. The gradual changes in seasons also contribute to their physical uniformity, as they all consume the same food, wear similar clothing, breathe dense air, drink water from snow and ice, and lack strenuous activities. Although the males and females appear similar due to their fatty physiques and lack of body hair, the uniform climate also contributes to the uniformity of their shapes, with little variation in physical characteristics unless caused by disease or extreme circumstances.
The authors argue that Scythians are infertile due to the physical constitution of both men and women.
The author argues that the varied climate in Europe, with its distinct seasons, weather patterns, and geographical features, has shaped the physical characteristics and temperaments of European populations. The author describes how different environmental conditions shape the physical characteristics and personalities of various European tribes. Mountainous regions with extreme seasonal changes produce robust, warlike people with a strong savage streak, while low-lying areas with meadows and stagnant waters yield shorter, broader individuals with dark hair and complexion, less inclined to phlegmatic temperaments. In well-watered, high-altitude regions, people tend to be tall and similar in appearance, but less courageous and more gentle. The author asserts that a country's natural characteristics, including its water and soil quality, significantly influence the physical and mental traits of its inhabitants. Fertile, well-watered lands produce soft, indolent people, while rugged, unforgiving environments foster hardy, industrious individuals with sharp intellects and military prowess. The Book of Prognostics. A physician should focus on developing their predictive skills in prognosis. By accurately forecasting a patient's condition, past habits, and future outcome, a doctor can gain the trust of their patients and their families. This foresight enables the physician to better manage treatment, as they'll be well prepared for the natural progression of the disease. Although it's impossible to heal every patient, having this predictive ability helps the doctor understand when a condition is beyond a patient's constitution, or even when there's an element of fate at play in the disease. As a result, the physician can wisely allocate their efforts and avoid criticism by accurately announcing which patients will survive and which won't, all while demonstrating their expertise. Similarly, if the disease has progressed on days 3 or 4, and the countenance is concerning along with other bad symptoms, e.g. eye discharge, squinting red whites, gummed eyes, it foretells a fatal outcome. During severe illnesses like fevers, pneumonia, phrenitis, or headaches, one's noticed that people tend to move their hands in a waving motion in front of their face, as if they're searching for something non-existent. Easy and unlaboured respiration, however, is generally beneficial for patients in acute illnesses like fevers that resolve within 40 days. On the other hand, cold sweats limited to the head, face, and neck in an acute fever suggest impending death, while in milder fevers they indicate prolonged illness. Point 8. Dropsies caused by acute diseases are unfavourable because they don't alleviate the fever and can be very painful and even fatal. Retracted testicles and genitalia indicate severe pain and a high risk of death. Borberage me, rumbles of gas, in the hypochondria can relieve recent abdominal pains and swellings if accompanied by a bowel movement, urination, or flatulence. A person's urine can indicate the severity and duration of an illness. If someone consistently passes thin and crude urine as they recover from an illness, it may indicate a potential abscess below the diaphragm. The direction and colour of clouds in the urine can also be indicative of the disease's severity or recovery. Rising clouds with certain colours are unfavourable, while falling clouds with other colours are positive. When persistent pain in the chest or abdomen persists, despite expectoration of sputum, bowel movements, bloodletting, medication, or a suitable diet, it's likely to culminate in suppuration. Favourable signs include easy tolerance of the disease, unimpeded breathing, absence of pain, effortless expectoration, a warm and soft body temperature, lack of thirst and normal urine, stool, sleep, and sweat patterns. Conversely, unfavourable symptoms like difficulty bearing the disease, laboured breathing, persistent pain, and difficulty coughing up sputum, along with strong thirst, uneven body heat, cold extremities, abnormal urination, stool, sleep, and sweat patterns, indicate a poor prognosis if they occur by day 9 or 11. If the patient reports feeling a weight in the area where they previously experienced pain, it may indicate the start of suppuration. Empyema can be identified by several persistent symptoms: unrelenting fever with nocturnal spikes, excessive sweating, lack of productive coughing, sunken eyes, facial red spots, bent nails, hot fingers, swollen feet, loss of appetite, and small blisters, phlistonae, on the skin. In acute cases, these symptoms are accompanied by difficulty breathing, pain, and severe coughing and drooling. The likelihood of the abscess rupturing can be estimated based on the severity of these symptoms. If pain and respiratory distress occur at the onset, rupture might happen within 20 days or earlier. Milder symptoms suggest a later rupture. Patients who recover quickly after abscess rupture tend to have their fever resolve on the same day, regaining appetite and experiencing small, consistent bowel movements with white, smooth, uniform stool that's free from phlegm, without discomfort or intense coughing. In contrast, those who die typically exhibit persistent fever, thirst without food desire, watery stools, green or frothy expectoration, or a combination of these symptoms. When individuals recover from pneumonia, like afflictions, abscesses that form in the ear area or lower extremities, resulting in fistulas, are often a positive sign. However, if fever persists, pain doesn't subside, expectoration isn't normal, and bowel movements aren't regular with proper consistency, but other symptoms indicate recovery is underway, abscesses might still develop. In cases where abscesses disappear, but fever and lack of expectoration persist, this is a poor sign, indicating a potential for delirium and death. Severe abdominal pains accompanied by fever can be deadly if they spread to the diaphragm and worsen over time. A hard and painful bladder is an extremely bad sign, especially when accompanied by persistent fever. But if these urine characteristics don't improve and the bladder remains hard, along with continuous fever, the patient's death may occur early in the illness. The progression of fevers can be predicted based on their initial severity and symptoms. Those who will recover typically exhibit favourable symptoms from the start, such as easy breathing, no pain, good sleep, and other positive signs. By observing the initial symptoms and tracking the fever's progression in 4-day increments, it's possible to make an educated guess about its outcome. Prolonged headaches with fever can be life-threatening, especially when accompanied by severe symptoms. Recently occurring pain is more likely to lead to nosebleeds or suppurations if it's located above the temples and forehead. Younger individuals under 30 are at higher risk for bleeding, while older people are more prone to suppuration. Severe ear pain accompanied by persistent and high fever is a worrisome combination, as it can lead to delirium and even death. The prognosis varies with age. Younger individuals typically succumb to this condition within 7 days or earlier, whereas older people may recover later since their fevers and delirium are less frequent. Younger patients die before the ear abscesses form, except in cases where pus appears from the ear, offering hope for recovery if other favorable signs are present. A severe throat ulceration accompanied by fever poses a significant threat to one's life, especially when combined with other poor prognostic signs. Quinsys that occur internally without visible symptoms on the forces or neck but cause great pain and breathing difficulties are particularly deadly, often leading to suffocation within a few days. Predicting recovery or death from an acute disease depends on a comprehensive assessment of the patient's symptoms. To accurately predict patient outcomes, including recovery or mortality, and anticipate the duration of illness based on the presence or absence of specific symptoms, one must first become familiar with these symptoms and their relative importance. Understanding that certain unfavorable symptoms typically indicate poor outcomes while favorable ones suggest recovery can aid in making accurate judgment. On regimen in acute diseases, the authors of the Canadian sentences accurately described patient symptoms and outcomes, making it possible for non-physicians to identify them with proper questioning. However, they often neglected essential symptoms that physicians should know without the patient's report. The descriptions on treatment are where the biggest disagreement lies. I don't agree with their rules because they rely heavily on a few remedies. Drastic purgatives, whey and milk. Even if these were effective, which they're not, the limited number of treatments would be insufficient for various complaints. While some modern reworkings of the sentences provide more medical insight into treatments, the ancient texts still lack substantial information on regimen. The common misconception arises from the simplicity of recalling medication names like petosan juice or hydromel, leading people to assume that anyone can be a skilled physician when prescribing such treatments. Initially, the amount of petosan given shouldn't be excessive, but rather in proportion to the patient's usual food intake to avoid depleting their veins. If the disease is more dry than expected, hydromel or wine should be given before the Tyson, and if the mouth and lung passages are sufficiently moist, the pison dose can be increased, as an early crisis often indicates a positive outcome. This tragedy often occurs due to unseasonable consumption of pitosan or other harmful foods and drinks, which can worsen the condition by not allowing the phlegm to be expelled and intensifying the respiration difficulties. Oxymel can be used to alleviate pain, while hydromel and water help with thirst. In cases where symptoms worsen or danger signs appear, a smaller dose of the medicine should be given, and this is especially true after the 7th day if the patient is strong. When the patient's feet are cold, it's best to avoid giving the medicine and drinking, but once their body temperature returns to normal, the treatment can resume. When administering these treatments, it's essential to monitor and adjust dosages based on the individual's response, gradually increasing doses until the pain subsides or until a crisis occurs in the disease progression. I'm aware that many physicians contradict this approach by initially fasting their patients for 2-3 days or more before introducing tisanes and drinks, likely reasoning that one significant change in the body should be countered by another. Sudden changes can lead to discomfort, weakness, and other negative effects. Some individuals with certain conditions, like biliousness, are more negatively affected by such changes than others, like those who are pituitous. When an individual eats something new, like the flatulent-inducing masa, it can cause stomach discomfort and issues. Drinking wine or water regularly and then suddenly switching can cause issues like stomach upset, bloating, headaches, or thirst. The sudden introduction of a strong, sweet wine can have distinct effects on the body compared to its usual intake. This serves as a strong evidence point against prescribing certain diets from the start, especially when they might not be suitable for the patient's condition. The author argues that physicians often enforce total abstinence or change to tisanes at the wrong times, leading to negative consequences. In some cases, patients experience severe symptoms like delirium, anxiety, and respiratory distress if they don't receive proper diet and treatment early on. If a patient is mistakenly deprived of food due to perceived inanition, while actually being weakened by pain or disease, it may not be immediately harmful, but can lead to ridicule if another physician corrects the mistake and brings about improvement in the patient's condition. For instance, feeding someone with a severe lack of food an excessive amount can cause harm, just as abruptly switching from a heavy diet to complete fasting or transitioning from intense physical activity to complete idleness. It's crucial not to apply phlegm-inducing treatments until the disease has been processed or other symptoms emerge in the digestive system or hypochondria, as described later. To determine when to use wine, sweet, strong, dark hydromel, water or oxymel in acute diseases based on symptoms, one must consider their effects on the body. Sweet wine primarily affects the digestive system, inducing bowel movements but causing swelling of the liver and spleen. Darker wines, especially stronger ones, can prove more beneficial for bowel health, but may cause harm to the upper digestive system and bladder if used in excess. In summary,
Sweet wine
induces bowel movements, causes flatulence, less diuretic, more expectorant. Yellow or dark wines can be beneficial alternatives for those without symptoms of heaviness, delirium, or difficulty expectorating, and may aid in bowel health, but be harsher on the upper digestive system and bladder. However, when used as the sole beverage during treatment of certain diseases, hydromel is often effective and reliable. When used in combination with tisanes, hydromel can have adverse effects. However, consuming it before a tisane drink might mitigate these negative consequences. However, if it's too acidic, it may have the opposite effect in some cases, making phlegm more viscous and causing harm. Water is not an effective thirst quencher, as it tends to produce bile in bilious individuals and can harm the hypochondrium. Drinking water can also cause stomach discomfort, slow digestion, and fail to induce bowel movements or urination. The bath is generally more beneficial for patients with pneumonia than those with high fevers, as it soothes pain and alleviates symptoms such as fatigue and respiratory issues. However, certain individuals may not benefit from or might even be harmed by the bath, including those with loose bowels, severe constipation without prior evacuation, or conditions like nausea, vomiting, hemorrhage, and dehydration. Book 1 of the Epidemics. Sec. 1. Constitution first. In Thasus, around the autumnal equinox, the weather was characterized by abundant and consistent rains, soft and southerly winds during autumn and winter, and a milder spring. Most patients experienced symptoms that included continuous fevers with rigors. No complete remission of these fevers, but rather they would ebb and flow in intensity. Constant sweating, except on the entire body. Cold extremities that were difficult to warm.
Disordered bowels with frequent, bilious, thin, and pungent bowel movement.
These individuals suffered from fevers, chills, and inadequate sweating with irregular, non-intermittent paroxysms that sometimes took a tertian, recurring every other day, form. Around the time of the star Arcturus, many patients experienced their crisis on the 11th day, and they were less likely to relapse or die compared to others. Children in particular seemed more resistant during this period. Many people experienced ardent fevers with severe symptoms, including delirium, thirst, nausea, cold extremities, and no general sweating. In some cases, the fever was milder initially but grew more violent around the 7th day. Fever types can vary greatly, including continuous fevers that persist throughout the day or night with varying intensities, as well as semi-tertian, tertian, tertian, quartan, quintan, septan, and nonan fevers, each with distinct characteristics. Philiscus, residing near the wall, fell ill with acute fever on the 1st day. On the 2nd day, symptoms worsened. He experienced relief after passing stool through a clyster in the evening, then slept well at night. On the 4th day, symptoms intensified with black urine. That night was relatively more comfortable. He eventually died around mid-6th day, still experiencing loss of speech, cold sweats, and livid extremities. Over time, his condition worsened. Day I. Fever started with bilious, frothy stools, black urine, thirst, dry tongue, and insomnia. Day 2. Fever increased. Stools became thinner and more copious. Urine remained black. He had an uncomfortable night with slight delirium. Day 3, 4. Symptoms worsened. Abdominal distension, dark-coloured stools, muddy urine, no sleep and excessive talking, laughing and singing. Day 6E. He experienced sweating on the head, cold extremities, restlessness, and a cessation of bowel movements and urine output due to acute fever. Day 8-9. The patient had a general sweat, with small persistent rashes, like variola, undigested stools, painful urination, and comatose sleep. Throughout his illness, he experienced slow and deep breathing, a persistent throbbing in the hypochondrium, and a fever that lasted for 10 days before death. Case 3. Hierophon developed an acute fever and initially experienced infrequent tenesmus, attended bowel movements. He suffered from insomnia, dark, thin urine, and by the 5th day he became deaf and his symptoms worsened, with a swollen spleen and abdominal distension. The crisis took place on the 9th day, but the fever relapsed on the 12th day, accompanied by a re-swollen spleen and deafness. 3 days later, the spleen decreased in size, and while his deafness lessened, he experienced leg pains and nighttime sweating. Over the next few days, her condition worsened with insomnia, delirium, and severe bowel movements that were bilious in colour. On the 8th day, she had a fever-induced rigour, and while her delirium lessened, her body pains persisted. However, a new bout of fever set in around the 14th day, accompanied by vomiting bile and yellow matter, followed by a return to normal body temperature. Her health continued to fluctuate over the next several days, with recurring fevers, delirium, thirst, and persistent pain on her left side, along with a cough. A notable change occurred around the 21st day, when she experienced deafness, in addition to these symptoms. The woman eventually entered a period of recovery, becoming free of fever by the 27th day. Patient Cleonactides suffered from an irregular fever, initially experiencing headaches and left-sided pain, along with fatigue-like symptoms.
The fever's paroxysms were unpredictable and occurred more frequently on certain days.
As the illness progressed, he experienced cold hands around day 24, followed by frequent and intense vomiting of yellow bile that later turned green. By day 60, the sediment in his urine became copious, white and smooth, coinciding with an improvement in symptoms, the fever's remission, and thin, well-coloured urine. The patient remained fever-free for 10 days, until a rigour and acute fever occurred on day 80, accompanied by profuse sweating, reddish urine with a smooth sediment, and a clear crisis. After drinking plenty of water and having a bowel movement the next day, symptoms worsened on the 3rd day, with headaches, thin bilious stools, and blood from his right nostril at night. On the 5th day, Meton experienced a massive nosebleed on his left side, followed by sweating and entering crisis. He spent the first night restless and agitated, then experienced pain during the day on the 2nd day, followed by more severe symptoms at night, including delirium. By morning on the 5th day, Erasinus appeared coherent, but soon became violently mad, unable to control himself, exhibiting cold and livid extremities, dark urine without sediment, and continued bowel movements throughout his illness. Case study. A Clazomenian individual was hospitalized near Phrynishides well after developing a fever, head, neck, and back pain, followed by deafness, insomnia, and elevated hypochondria, with swelling but not severe distension, and a dry tongue. However, fever returned on day 18, accompanied by ear pain, incoherence, and leg discomfort. The patient experienced a crisis around day 20, free from fever, with no sweating or other issues. Around day 31, the person developed a watery diarrhea with dysentery symptoms, followed by thick urine output and complete resolution of ear swelling. However, 2 days later, she suddenly developed chills, high fever, and abdominal pain in her hypochondrial region. On the day following, her bowel movements returned to normal, but her urine was abnormally thick and milky with no sediment. On the 3rd day, she suffered another rigour and high fever, with persistent abdominal pain, nausea, and an uncomfortable night without sleep. On the 4th day, her hypochondrial symptoms somewhat subsided, but she experienced headaches, dizziness, a minor nosebleed, dry mouth, thirst, and thin, oily urine. Over the next few days, his symptoms worsened. He suffered from widespread pains on the 4th day, followed by smooth, oily, and abundant urine. By the 5th day, she experienced a sharp fever, remained disoriented, and suffered from bilious stools. The following day, her mental clarity improved, but she still had pain near her left shoulder blade, was thirsty, didn't sleep, and had thin urine. For 3 days, she remained free of fever. However, on the 11th day, she relapsed into a fever accompanied by chills. By around the 14th day, she vomited bile and yellow matter, had another sweat, and finally recovered from the illness as her fever came to a natural end. Case I. Pythian, residing near the Temple of Earth, initially experienced trembling in his hands, accompanied by high fever and delirium, with symptoms worsening over the first 3 days. By the 8th day, all symptoms worsened again, including constant tremors, thin urine lacking color, and cloudy sediment. Following the crisis, an abscess developed near the anus on the 40th day, but resolved through strangury, painful passing of urine. Interpretation of patient's progress. The massive release of urine likely contributed to the successful treatment outcome, resulting in the patient's recovery by the 40th day. Case 2. Hippocrates, who lived near the new wall, developed a fever with symptoms that persisted for several days. Around the 17th day, Hippocrates experienced a relapse, becoming hot again and entering an acute fever phase. On the 20th day, he entered a crisis state, free from fever, with no sweat or appetite, but in deep sleep. The acute fever returned on subsequent days, accompanied by a parched tongue. Character, summary, and cause of death. The character's demise likely resulted from a lack of bowel movements rather than any other factor on the 27th day following an initial incident or treatment that might have involved hindering natural bodily functions. Fever persisted through the 10th day before the patient experienced a brief period of recovery and normalcy. The next few days were marked by variations in urine color, frequency of bowel movements, and pain in various parts of his body, legs, knees, hip joint, right eye. The patient experienced a complete crisis around the 40th day, characterized by frequent white, pituitous stools, profuse sweating, and overall improvement. A summary of the patient's recovery can be attributed to the elimination of bodily waste products,
Stool, urine, and sweat,
which likely occurred within a 40-day period, leading to their cure. Charion, who was staying at Demonitus's house, developed a fever after drinking and began experiencing symptoms like headaches, insomnia, and gastrointestinal issues with bilious discharges. Over the next few days, his condition worsened.
he experienced acute fevers, convulsions, delirium, and remained restless at night.
On the 6th day, Charion's symptoms persisted, but on the 7th, a rigor and acute fever led to sweating and a crisis. On the 18th day, Charion had some residual symptoms: mild heat, thirst, thin urine with cloudy sediment, and slight mental confusion. By the 6th day, her fever subsided, but she didn't sweat.
Instead, she had a crisis, and a small abscess on her buttocks burst at that time.
The first day, she felt chilly, but then developed a fever. By the 3rd day, she had a severe chill, high fever, and a painful swelling on both sides of her neck and chest. His symptoms worsened daily. Day I.
Fever led to diarrhea, thirst, and insomnia.
Day 2. Symptoms intensified. More frequent and unusual bowel movements, continued lack of sleep, mental disorientation, and slight sweating. Day 3.
He became restless, experiencing increased thirst, nausea, and delirium.
On the 2nd day, she had a severe chill, intense fever, and continued to have loose stools. By the third day, her symptoms worsened. Frequent, unformed bowel movements during the night and lack of rest. By the fifth day, all symptoms had intensified. She spoke incoherently, then suddenly became coherent again. Showed no signs of thirst. Remained sleepless. Experienced frequent, unseasonable bowel movements, and produced scant, dark urine. She remained in this state on the sixth day before passing away on the seventh, likely due to phrenitis, a type of brain fever. A 17-year-old woman, having recently given birth and experiencing a difficult labor, developed severe symptoms of an intense fever. Her condition worsened over the next several days, characterized by rigors, shivers, high fever, sweating, cold extremities, and constant restlessness. On the eighth day, her symptoms shifted. She became comatose, vomited yellowish bile, and experienced frequent urination without awareness. Her condition began to improve on the ninth day, but then relapsed with a rigor, fever, vomiting, and lack of sleep. The woman's symptoms continued to fluctuate over the next few days, including green-colored bile vomiting, rigors, cold extremities, and severe pain. On the 12th day, she experienced copious black and foul-smelling vomits, intense hiccuping, and painful thirst. Many people suffered from speech difficulties or complete loss of ability to speak. Initially, those with early stages of tuberculosis were affected, but also individuals experiencing severe fever or delirium. The typical symptoms of ardent fevers at the onset were coma, nausea, shivering, mild fever, no intense thirst or delirium, occasional nosebleeds, and paroxysms that often occurred on even days. In some cases, the disease resolved without fever, but in others it was marked by severe abdominal pain, malignant volvulae, and difficulty passing stool, despite purgative treatments that often worsened symptoms. These fever types caused significant disturbances because, in most cases, the bowels were disordered, along with rigors, uncritical sweating, and abnormal urine conditions. While some patients experienced a crisis around the 80th day, most cases ended irregularly. The disease's symptoms included frequent rigors, high fever, unseasonable sweats, and extreme coldness that was challenging to warm up. A patient in Phasis experienced a prolonged illness that lasted 120 days. On some days, he experienced epistaxis, nosebleed, and slight fever relapses. Interpretation of the figures involved. The vulnerability brought about by the fever, inflammation of the brain, and issues with the digestive system, hypochondrium, likely led to the person's demise around the 120th day. Initially, she had fever-like symptoms before delivery, and then suffered from acute fevers with rigors following childbirth when lochial discharge didn't occur on time.
Symptoms progressed as follows:
Incoherence, followed by coherence. Diarrhea with bilious stools. No thirst, days 8, 11.
onset of coma, with copious black urine and lack of sleep, day 11.
Recurrence of fever, incoherence, and constipation, days 20-27. Pain in the right hip joint, followed by fevers and watery urine, days 27-40. Coughs with watery sputum, constipation, food aversion, and irregular fevers, days 40-60. Convulsive jaw retraction, coma, speech loss, then regaining coherence and speech, days 60. Death on the 80th day. The symptoms began with strong rigor, high fever, dry tongue, thirst, and dark urine with sediment that didn't settle. Over the next few days, his condition fluctuated.
He experienced coldness, loss of speech and articulation, shortness of breath and nausea.
His temperature rose and fell, and he had periods of restlessness and sleeplessness. On even days, 2nd, 4th, 6th, and 8th, his symptoms worsened with increased pain, fever, and difficulty speaking. On the 10th day, Pythian's condition dramatically deteriorated.
He became speechless, extremely cold, had a high fever and excessive sweating.
The text likely suggests that a character's severe sweating may have led to their demise on the 10th day, implying that their sweat-related condition was the cause of their fatal outcome. Case 4, Case 4. A patient with phrenitis, who initially went to bed, experienced significant vomiting of a greenish tint and watery consistency on day 1. They exhibited fever accompanied by chills, persistent sweating all over, headaches, neck pain, thin urine with tiny scattered particles that didn't settle, frequent bowel movements, delirium and insomnia. The next day, his thigh pains subsided, only for the fever to intensify. He was restless, couldn't sleep, and had cold extremities, frequent urination, and poor quality urine output. On the 3rd day, his fever subsided, and he passed a quiet night. On the 14th day, mental confusion set in, but her fever subsided.
He developed an acute fever, right-sided pain, dry cough without phlegm thirst, and insomnia on the first few days.
By day 7, the fever intensified, along with chest pains, a troublesome cough accompanied by shortness of breath. By the 11th day, the fever subsided, and Anaxion experienced minor sweating on the head, productive coughs with more liquid phlegm, and felt relief. Following the crisis, he developed thirst again, and his expectorations weren't ideal until the 27th day, when the fever relapsed. He soon became bedridden and developed an acute, intense fever with symptoms including bilious vomiting, excessive thirst, restlessness, and dark urine. Around the 14th day, he began experiencing deafness as the fever intensified. Eventually, around the 100th and 120th days, Herapaethus experienced a complete recovery from his ardent fever.
His condition worsened on the 2nd day with increased fever, chills, vomiting of yellow bile, and poor sleep quality.
On the 4th day, he experienced rigors, high fever, widespread aches, and changes in his urine. His condition improved on the 7th day, but deteriorated again by the 8th, with all other symptoms except pains subsiding.
By the 20th day, his urine was white and thick, sediment, free after standing, and he experienced copious sweating.
Although still hot in the evening with pains and thirst, the fever seemed to be abating. On the 24th day, his urine was abundant, white, and sedimented.
He broke out in a warm sweat all over, had no fever, and reached the crisis of his illness.
Her condition persisted into the 2nd day, with no sleep, increasing fever, and more spasms. On the 6th day, she experienced a severe nosebleed, followed by chills and an intense sweat. Notably, her symptoms worsened on even days 2nd, 4th, and 6th, but she did not experience a relapse. The fever ultimately came to an end. As the days passed, Apollonius experienced severe symptoms.
Lack of sleep, gas, intense thirst, drowsiness, painful swelling in the right upper abdomen, and mental confusion with forgetfulness.
Around day 14, he suffered a fever-induced rigor, followed by delirium with loud cries, then a period of calm before descending into coma. On day 30, Apollonius's fever intensified, accompanied by profuse, thin stools, delirium, cold extremities, and loss of speech. He ultimately passed away on the 34th day of his illness, characterized throughout by disordered bowels, dark, thin urine, a tendency towards coma, insomnia, cold extremities, and continuous delirium. As the days progressed, her condition worsened. On the 6th day, she had incoherent conversations and no sleep. By the 11th day, she experienced wild delirium, followed by periods of clarity. The woman's condition further deteriorated. On the 14th day, she suffered from convulsions, with cold extremities and a lack of coherence. Around the same time, her urine production stopped. The woman ultimately died on the 17th day due to phrenitis, a severe inflammation of the brain, often caused by fever or infection following childbirth. On injuries of the head. The shape of a man's skull can vary significantly, just as their heads do. The suture lines on a person's skull are arranged differently, depending on whether they have a bony prominence at the front or back of their head. If the prominence is at the front, the sutures resemble the Greek letter tau T, while if it's at the back, they resemble the opposite form of that letter. If there are prominences at both the front and back, the sutures take on the shape of the letter eta, E. Additionally, pus takes longer to form and penetrate the skull in posterior head wounds due to the thickness of the bone, contributing to higher survival rates for those injured in the back of the head. However, if a suture, a natural seam in the bone, is exposed in an open wound, regardless of where it's located on the head, this can be the weakest point to resist a blow or weapon, especially when the weapon strikes the suture directly. A broken bone in this region will inevitably cause contusion at the point of fracture and surrounding areas due to the instrument causing the break. A contusion can occur in a bone without causing a fracture. This is true even immediately after the injury occurs, regardless of whether the bone was actually bruised, just like with certain types of fractures that aren't visible from the outside and are located away from the initial point of trauma. This depression occurs because the fractured portion is pushed inwards while the rest of the bone remains undisturbed, resulting in a combination of fracture and depression. This is the third type. There are 4 modes of injury when a weapon strikes a bone. 1. A simple indentation, hedra, without fracture or contusion. 2. An indentation accompanied by a fracture, which always comes with some degree of contusion. 3. An indentation accompanied by contusion in the surrounding bones, but no fracture. And 4. An indentation, hedra. A bone may be fractured in a location separate from where an individual suffered a wound to the skull, and the bone could now be exposed. Of the various types of fractures, those that necessitate trepanning include contusions with or without bone exposure and fissures, whether visible or not. Additionally, if an indentation caused by a weapon leads to both fracture and contusion in a bone, or even just contusion alone, trepanning is required. However, a bone that has been depressed from its natural position usually doesn't need trepanning unless it's severely broken. The opposite is true for bones with significant pressure and fractures, which often require less intervention. If the bone's state isn't immediately apparent, inquire about the wound's origin and circumstances, especially when contusions or fractures might be present but not visible. The text discusses the types of injuries that can occur to bones and the surrounding flesh when struck by various objects. It emphasizes that a bone can suffer fractures, either visible or not, contusions, depression from its natural position, and other trauma due to intentional or unintentional blows, falls, or instrument strikes. The text highlights that falling from a great height onto a hard, blunt surface increases the risk of bone fracture and depression, whereas landing on softer ground may result in less severe injuries. When a bone is exposed and the wound occurs at the suture lines, distinguishing between the natural indentation, hedra, of the suture and the mark left by a weapon can be challenging. In addition, when a fracture occurs at the suture line, it can be even harder to detect because the bone is naturally weaker there. The author also emphasizes that incision may be necessary for wounds on the head if the bone is exposed and the wound doesn't allow for a clear inspection of the bone's condition.
When opening a head wound that exposes bone due to flesh removal for blow injury assessment, make an incision proportional to the wound's size and necessary depth.
If the bone damage is not visible, despite the appearance of instrument penetration, scrape the bone with a raspberry to a depth and length corresponding to the patient's sutures, both longitudinally and transversely, to uncover any unapparent fractures or contusions. If the blow has left an indentation on the bone, dint, scrape it and surrounding areas to reveal any combined fractures, contusions, or underlying damage. When the situation suggests a broken, contused, or both injured bone, due to the severity of the wound, patient's description, and knowledge of the weapon used, e.g. strong person, dangerous weapon, symptoms like vertigo, but the extent of the damage is unclear. 1. 2.
Clean the wound the next day and scrape the bone with a raspberry to assess the damage.
3. If the bone is fractured and contused, the scraped surface will be white except for the blackened fracture and contusion areas, which indicate the extent of the damage. In summary, this text provides a step-by-step guide on how to assess and treat head wounds that expose bone, including scraping the bone with a raspberry to uncover any unapparent fractures or contusions.
When a skull fracture occurs due to a blow or prolonged exposure, a loose piece of bone can separate.
If the bone is exposed, it's crucial to examine whether it's fractured, contused, or both. When a head wound exposes bone, whether previously operated on or not, a red swollen rash typically appears on the face, possibly affecting both eyes. In general, treat the wound appropriately after trepanning, considering factors like heat buildup in the bone.